Pharyngotonsillitis, also known as tonsillitis or pharyngitis, is characterized by pain and redness of the throat, that is, the oropharynx, in addition to an increase in the size of one or both tonsils and fever. The main cause of this disease is the invasion of the tonsils by viruses. The second cause is infection by bacteria, mainly group A beta-hemolytic streptococcus. The symptoms of this condition are of little use to know precisely if it's caused by viruses or bacteria. However, viral pharyngotonsillitis can occasionally be characterized by gradual onset and progressive worsening, moderate fever, usually less than 102 Fahrenheit degrees, redness of the oropharynx and enlargement of one or both tonsils with moderate pain, presence of small swollen glands in the neck, respiratory type symptoms such as runny nose, hoarseness, and cough, red irritated eyes, and little affectation to the general condition. For its part, pharyngotonsillitis caused by bacteria could manifest itself in the following way: sudden start, high fever generally greater than 102 Fahrenheit degrees, very reddened oropharynx, enlargement of one or both tonsils with the presence of red dots on the surface, foci of pus or wiry plaques, increased size of the lymph nodes in the neck, which are perceived as painful balls on the palpation, and attack on the general condition, such as headache, nausea, vomiting, and abdominal pain. Now take note, because the best and simplest natural home remedies for the treatment of tonsillitis are described here, so that you can choose the one that's most convenient for you. These remedies act against pain, deflate tonsils, and even kill bacteria and limit viruses. 1. Calendula tea. The ingredients necessary for the preparation of this formula are a tablespoon of dried calendula petals, a cup of water equivalent to 250 milliliters, and 2 tablespoons of honey. Calendula is also known as marigold and buttercup. For its preparation in tea, the water is boiled, the dry petals of the plant are added, the fire is turned off, the container is covered, and the infusion is left to rest. Then it's strained, the honey is added, and that's all. It's recommended to drink 1 cup in the morning and 1 at night. 2. Thyme tea. The ingredients required to make this recipe are a tablespoon of thyme, equivalent to 10 grams, a cup of water, the use of half a lemon, and 2 tablespoons of honey. To prepare it, pour the thyme in boiling water, turn off the heat, cover the container, let the liquid settle, strain it, pour in the lemon juice, and sweeten with honey. 1 cup should be taken in the morning and 1 cup at night. 3. Garlic with honey. This preparation requires a clove of raw garlic and a tablespoon of honey. To make this formula, you must crush a clove of raw garlic, mix it with honey, and eat it. If desired, the remedy can be diluted in half a cup of warm water and drunk. This formula should be taken daily in the morning. 4. Apple cider vinegar and honey. The ingredients of this remedy are 10 milliliters of apple cider vinegar, a cup of water, and honey to taste. Its preparation consists of adding apple cider vinegar to boiling water, then turn off the heat, let the mixture rest, add honey to taste, and drink a cup every 12 hours. In addition to taking this remedy that has been chosen, it's recommended to gargle with calendula, guacamole, or salt 2 to 3 times a day. Gargling consists of rinsing the mouth for several seconds with one of the remedies described below, allowing the liquid to reach the throat, and then spitting it out. This process is repeated each time until the content of a 250 milliliters cup is exhausted. The ingredients to prepare calendula water are a tablespoon of dried calendula petals and 250 milliliters of water. The water is boiled, the calendula is added, the fire is turned off, the container is covered, and the infusion is allowed to warm up a bit. Then it's strained, and that's all. It's ready to gargle. Now, to prepare the guacamole water, the following are required. 4 pieces of guacamole bark, equivalent to 40 grams, and 500 milliliters of water. For its preparation, the pieces of guacamole are put in the water and allowed to simmer for 5 minutes. Then turn off the heat, let it warm up just a little, and it's ready to gargle. Leftover water can be saved and reheated for use. Finally, the ingredients to prepare the salt water are 1/4 tablespoon of salt and 200 milliliters of water. The preparation is simple. Just put the salt in the warm water, stir, and that's it. After gargling, you can rinse your mouth with plain water to remove residual salty taste. Now let's talk about drug treatment. For those who prefer allopathic medicine, they should know that there's no specific treatment for tonsillitis of viral origin. In these cases, therapy is symptomatic and aims to relieve pain, fever, and associated systemic or respiratory symptoms, for which general measures and drugs are indicated. General measures include drinking plenty of fluids throughout the day and gargling with calendula water, guanciale latte, or salt as explained above. To control pain and fever, you can take acetaminophen or ibuprofen. For runny nose and watery eyes, an oral antihistamine such as loratadine, diphenhydramine, or chlorphenamine can be used. In general terms, pharyngotonsillitis caused by viruses resolves spontaneously in about a week without leaving sequelae. On the other hand, the treatment of tonsillitis caused by bacteria requires the use of a specific antibiotic against the germ causing the infection. You can choose one of the following options. 1. Penicillins, for example, oral penicillin V, oral amoxicillin, or intramuscular benzathine penicillin. And 2. Macrolides. Chief among these are erythromycin, clarithromycin, and azithromycin. They're especially indicated in people allergic to penicillin. Now, for the treatment of pain and fever, acetaminophen or ibuprofen is recommended. And in case of runny nose and conjunctivitis, one of the antihistamines mentioned in the previous point is indicated. Most bacterial pharyngotonsillitis have a good prognosis and usually resolve within 7 to 10 days with appropriate treatment. In patients with repeated tonsillitis and respiratory tract infections, the application of a mixture of antigens from autolysis of different bacteria can be indicated as a preventive treatment. On the market is, for example, Paspat in injectable solution. This compound works as an immunostimulant, so it helps launch an immune response that prevents infection caused by germs whose antigens are contained in the formula. There are also products for oral administration, also prepared based on lysates on different bacteria. One of the frequent commercial brands is Pulmonaram in solution. This product is indicated as a preventive medication in recurrent respiratory infections and as an adjuvant in the treatment of acute respiratory tract infections. We conclude by saying that self-medication is not recommended. Pharmacological treatment should always be indicated by the treating physician, who will make the respective prescription based on the particular characteristics of each patient and each disease.